My name is Tom Williams. I'm 76 years of age, and today I'm going to share my patient story with you. My cataract affected me in various ways. I used to be very keen on playing snooker, and I found that I couldn't focus. I had to take my glasses off to play, which affected my game considerably. So I had to stop. I had to stop playing because it was no good. My right eye was much worse than my left eye, and it's been like that for several years. It was affecting me really badly. I couldn't see a great deal at all out of my right eye, and it, like I said, it affected my social life. Reading was a problem, television was a problem, quite a lot of problems. I was suffering because of the cataract. I've had the problem for several years. It didn't come on suddenly. It was a very gradual deterioration. A lot of golf. I couldn't focus very well. That was a long distance driving. I found it was affected, particularly night driving. The light would be refracted into my eye, and I had to stop driving in dark or bright sunlight. Couldn't cope with it at all. The problem was noticeable to me 24/7. It was a permanent problem. I didn't only suffer it when I was driving, but it was reading and television, and it was affecting. It was walking along the street. It was becoming intolerable, really. My medical problems. I've got severe arthritis in my back and in my neck. I understood it was some kind of film which was developing over the eye, which was blurring your vision. When I was first told that I had a cataract, it was obviously a matter of concern because I had no idea what was entailed. But my friend, a very good friend of mine, he'd had it done fairly recently to my time, and he explained that it's fine, there's no problem. He saw me once or twice then I was referred to the hospital. They sent for me, went there, they did various tests, went there about 3 times just for him to keep checking up and checking. And then after about 9 months, I was referred in, went in again, they done tests, sent back, and then eventually I had the operation. The effect of the operation, I was expecting an improvement. I didn't expect for perfect vision. I was hoping for an improvement and expecting an improvement, which is what they told me. You will find that the sight in your right eye will be improved, and it was remarkable. It really was a drastic improvement in my right eye. What I expected, it was better than I expected, but it wasn't perfect. But it was a good result for me. Coming out, I was pleased that I had it done because it was not painful, and it cured my problem. I would say that if you explain to the person who's got the cataract all that's going on, particularly what a cataract is and what we're going to do, and you'll find no problems. I think the patient should be advised, as information should be imparted as much as possible. As they did with me, in all fairness, I was kept fully informed of everything. I was told that it might not succeed. There was a very, very small percentage that it wouldn't. But no, it was excellent. I'm very pleased to do this interview in the hope that it will help other people like myself having a much more placid view of the outcome and the treatment. Absolutely nothing whatsoever to be concerned about. Treatment is excellent. The outcome is excellent. If I've helped anybody by doing this, I'm I'm grateful. The world is a better place. I hope the ice situation is better as well.